Alessandro Della Chà, you're Chief Executive Officer of Cosmo Pharmaceuticals. The company posted a loss in 2017, which doesn't come as a surprise when you had a look at the first half results. But how could you explain in detail the loss figure of your company last year?
Sure. Well, first of all, what we look at as the real operating loss is something around 9 million euro, which was widely expected. Then the difference up to 15 million euros is made by our share of loss in our associate Cassiopeia, which is completing its development plan, and we expect to have the news on the phase 3 trial of Winlevi around end of May, beginning of June. That sums up to 15 million. Then the real difference, unfortunately, is just due to FX loss on our cash and investments, which we had actually split 50-50 in euro and dollar. So unfortunately, the dollar went down. So we have this FX loss, which is big actually. It's around 16 million. But if you really split the loss into these three components, then you realize the operating loss is 9 million, the Cassiopeia associated loss is 6, and the remaining is just FX loss.
So for next year or for 2018, you will post a loss of about 40 million euros again. So already now you can predict that figure. How is that figure made of in real numbers?
Well, that loss is exactly as expected, and it goes according to plan, because this year we will, depending on the approval by the FDA of methylene blue MMX, we will more than double our spending in the setup of the US commercial organization, because we expect exactly to double the size of the organization, which means another additional 110 employees will be hired in the US to assist the launch and start selling methylene blue as well. So it's really a massive investment. If you look at the guidance that we have now posted on our website, of all our projected expense in 2018, more than 78 million is what we call investment in Aries, and that's the only way that we have to operate in order to create value for shareholders, meaning set up a real functioning and well-organized US organization.
You mentioned it, the year 2018 will be crucial for Cosmo Pharmaceuticals, especially regarding the development in the US. There's an important drug, methylene blue, you mentioned it, which will be approved or not by the FDA in May. Are there any further details on the timetable of Cosmo in the US this year?
No, the FDA has given a projected PDUFA date for May 21st, so we're all waiting eagerly for that date, and clearly in this specific moment there's a lot of interaction ongoing with the agency, but then there are a lot of other catalysts in 2018, so I do agree it's a very important year. We also have, as I said, the readout of the phase 3 of Winlevi, then we will have hopefully the approval of rifamycin SV MMX, our new antibiotic, hopefully the filing of the NDA for remimazolam, the sedation agent. So this is going to be, yes, I agree with you, a crucial year.
Again, a loss this year, which is projected. So there was no dividend for 2017. So we can't be a prophet to say that no dividend either for 2018 when you project a loss.
Well, I think that we've always been very prudent as managers of Cosmo, and I think that it will look a little bit too much flamboyant to distribute dividend when there's a loss. I just don't think that it sounds right. It's true that a significant portion of the loss now was just due to, as I said, to an FX loss and an FX loss on dollars, which we intend to spend anyway, but still, we thought about it and we don't think it would have looked nice.
So when you have a look at the share price of Cosmo in the longer term backward, so we had a steep increase from 2012 to 2014. Then from 2014 until today, it more or less stagnates with ups and downs. But since mid-16, there's a negative tendency. It goes down more or less, not steeply, but constantly. How do we explain that decline in share price in the last 9 months?
The reality is that I cannot really explain it myself. I wish I could be able to explain increases or decreases in share price. I think a lot is due also to sentiment, and I think that the Cosmo shares have gone really well for a certain number of years, so I don't think it's surprising that now the company is deemed to have reached a certain level of maturity, and possibly a lot of investors that were early investors now want to exit because they don't want to wait for the next phase, which would make sense. It's also true that as a whole, in the whole sector, the biotech sector has gone down. So I'm not sure that we've gone down really in a worse fashion than the sector as a whole. But the only thing that I can say is that we think that we are proceeding according to plan, and with some delays, as for example the results of Methylene Blue, I think we've been more or less on track with everything that we said that we would have wanted to do.